Well, in other news, almost a year after the World Health Organization declared dementia, including Alzheimer's disease, as a non-communicable disease, the WHO is all set to declare it as a global health crisis, urging governments across the world to make it a health priority. For India, this declaration is crucial given that 90% of the cases go undetected. Kulsum reports.
Days away from the World Health Organization declaring dementia a global health priority, the Health Ministry struggles to explain how it tackles a disease that has no cure.
A strategy separately for dementia has not yet been put in place in the country. Anyway, in the 12th plan, where we are saying we are looking at those.
76-year-old Padma Devi, a grandmother of two, was diagnosed with Alzheimer's disease a few years ago. The classical music teacher barely remembers her notes now. The family constantly needs to monitor her movements. The severity of the disease increases with age, gradually affecting memory, speech, behavior and personality. Padma Devi is among the 3.7 million people in India affected. 10% people above 60 years and almost half the population above 85 has Alzheimer's disease. But 90% cases go undetected. Signs of the disease often misread as normal signs of aging. The world's highest health body, the WHO, is now warning governments across the world it's a global health crisis and needs priority.
A geriatric culture is relatively new in India, which is why we've already lost on precious time in tackling age-related problems. But this push is good, say experts. It might just coax the government into recognizing the threat of dementia.
People should be educated about how to recognize, how to understand, how to respond to people with dementia and its early onsets.
The costs involved in the diagnosis, care and awareness of dementia can be a big drain. So not surprising, many are skeptical if the declaration will do much.
We still spend under 3% of GDP on health. So the investment is not being commensurate with declarations. Even today the Planning Commission has not put in money for one old age home in any district of this country.
So after all the hype, will India take its cue and find solutions to an age-old problem? Kulsum, NDTV.
Do you have the NDTV Profit app? All the markets, all the news and your own homemade, ready-made portfolio available there for you.
We will right now answer what you should sell, what you should buy when markets are down.
Download at ndtvprofit.com/apps. Get the best app from the channel you trust.